environment and my patient. I'm looking to see if there's any hazards in the environment that could cause harm to myself or my patient. I'm also observing my patient. From the door, I can start to begin my inspection for the assessment. I see that her skin color looks normal for ethnicity. She doesn't appear cyanotic, jaundiced, pale. I don't see any obvious diaphoresis. She doesn't appear to be any respiratory distress. I don't see her using any accessory muscles. She's seated upright. She looks calm. She doesn't appear like she's having any problems breathing or trying to gasp for air. So I can go ahead and begin. So I'm going to knock on the door and enter the room. Hi, Miss K. My name is Kristen, and I'm a nursing student from Palm Beach Atlantic University. I came in the room today to do an assessment on your integumentary and respiratory systems. Would that be okay with you? Is this a good time?
Yeah.
Okay, so I'm going to go ahead and provide us some privacy and perform hygiene for your safety. And then if you don't mind, I'm also just going to confirm who you are with your ID bracelet, please. Can you tell me your name?
Jenna Rosa Cabanic,
Thank you, Ms. Cabanic, and your date of birth.
7/15/2005.
Fantastic, I have the same information, which means I have the right patient. I don't see an allergy band on your wrist today. Do you have any allergies I should be aware of?
No.
Okay, so no latex, medications, shellfish, anything?
No.
Okay. And can you tell me, these are just some standard questions I have to ask all my patients as part of my assessment, where you are right now?
The hospital.
Okay, and can you tell me what year it is?
2021.
And can you tell me why you're in the hospital today?
Surgery.
Okay, I have the same information, which means that my patient is awake, alert, and you're oriented to 4 things: person, place, time, and situation. Now, for your safety and for me to provide the best care to you today, I need to know, are you having any pain right now? You're gonna have to tell me yeah.
Yes.
Okay, I'm very sorry to hear that. I'd like to know a little bit more about it so that I can best take care of you. Can you tell me where your pain is right now?
In my knee.
In your knee. And is this pain new? When did it begin?
A month ago.
Oh, it's been going on for quite a while. Okay, so right now as you sit here today, on a scale of 0 to 10, 10 being the worst pain you've ever had, 1 is like very minimal. Where would you rate that on that pain scale?
An 8.
Oh, wow. Okay, so this is very significant. Is this why you're having surgery?
Yeah.
Okay. All right, so we're going to be very mindful of your knee today. Now, the pain in your knee, that's an 8. Can you describe it for me in a little bit more detail? Like, what does it feel like?
Like pulling, tugging.
A pulling and tugging pain. And does that pulling and tugging pain stay local to your knee, or does it radiate down your leg or anywhere else?
Just in my knee.
Okay. Is there anything that you have done for the pain to make it feel better?
No.
Okay, so you're just living with that at an 8. You poor thing, we need to help you out. And is there anything that you've done that makes the pain worse?
Walking.
And when you walk, how bad does it become?
10.
Okay, so this is some pretty serious pain that you're in, and I imagine it's feeling quite debilitating. So I'm hoping your surgery will have a positive outcome for you. The good news is the assessment I'm doing today doesn't require you to walk or get up or do anything with your knee. So with your permission, I'll go ahead and continue. Is that okay?
Yes.
Okay, do you have any questions or concerns for me?
No.
Okay, so as I go through the assessment today, I'll kind of walk you through what I'm doing and explain to you what I'm doing and why I'm doing it. I'm going to start off by assessing your scalp. You'll feel me. Is it okay if I touch your hair? Okay, so I'm going to be looking at my patient's hair. I'm assessing the distribution of her hair. I would be moving her hair around. I'm not going to mess up your hair. Looking for any lesions, rashes, or moles on her scalp. I see that her hair is evenly distributed and of thick texture. I'm also going to move down to the nape of the neck and look at the occipital region to see if I see any signs of nits or lice, which I don't see. I notice that she's well groomed and appears to have good hygiene. At the occipital region, I don't see any areas of redness. She's not wearing oxygen or mask, but if she was, I'd check behind her ears. Also checking again, skin exposed to the shoulders, the scapula, the backs of both elbows, and her sacrum. While I'm doing this, I'm also continuing my inspection of her skin, noticing any other obvious like lesions or rashes or things that I should note or be aware of or ask her about. Next, I'm going to check the backs of her heels. Again, this would be her actual heels. Observe there to see if there's any redness. I don't see any redness there, which means there's no sign of any pressure injuries. While I'm at your feet, I would also check at the feet and the tops of the ankles for any signs of edema or swelling. If there was swelling there, I'd want to go ahead and palpate that swelling to see if it is pitting or non-pitting edema. If it's pitting, give it a grade. Next, on the nail beds, again, a lot of pretend here, pressing on the toes on the nail bed, looking to see that the cap refill, it turns white and comes back pink within 3 seconds or less, which would indicate that you have good perfusion. I'm going to go ahead and do that same test on your fingernails. So I'm going to go ahead and check. I'm going to push on the nail bed and release, and I see that her color comes right back in 2 seconds or less, which is a normal finding and indicates that she has good blood flow, good perfusion to the tips of her fingers. I'm now going to use the backs of my hands. I'm going to start at your head and work my way down your body. Again, I would be on her skin. And I'm feeling to see if she's nice and warm. and also if she is dry. Okay, and she's nice and toasty. And all the way down to her toes, again, bilaterally warm and dry. Next test is for clubbing. You can help me with this one. This test, I'm gonna have you take 2 fingers like this, point them up towards the ceiling, and then pull them in like you're making a heart for Valentine's Day. And I see a nice little diamond there in the middle, which is a negative finding for clubbing. That tells me that you haven't had any issues with long-term low oxygen, which is a normal finding. Next, I'm going to do a test called tenting. This is just a quick little squeeze of the skin on the forearm. So I'm going to squeeze the skin and release. And you are young and have great skin elasticity. Your skin snaps right back, and there's no signs of dehydration because your skin also snaps right back. The last thing today for skin is assessment of a mole. Do you have any moles or freckles that you're worried about today or that have been bothering you or you've been concerned of?
No.
Okay. So since you're here for knee surgery, I'm going to take this opportunity to teach you some things that you can look for and any moles that do develop or change over time. There's an acronym that we use. It's a screening tool. It's not diagnostic. It's called the ABCDs of moles. And I'll tell you what each of those things stand for. So A stands for symmetry. So if you're looking at a mole or freckle, you really don't even have any. Like look at this little guy right here. You would want to see that that mole is symmetric. So if you fold it in half, it has a nice even fold. B is border. You want to see that the border is clear, well-defined, not jagged. C is color, like your freckle here is just a light brown color. That's normal. We don't want a mole that's multicolored, changing colors, especially the colors like blue, black, white, or gray. D is diameter. So if you take a pencil eraser and you cover it, it should disappear. If it's growing or evolving in size, that would be concerning as well. You would like your mole to be ideally less than 3 to 5 millimeters. Another E stands for elevation, so that means that the mole should be flush with the skin and not elevated, and also that the mole is not firm. So when you feel the mole, it feels the same texture as the rest of the skin, and G is kind of redundant, but it means growing, so again, growing in any way. Truly, any mole that changes at all is always something warranted of getting looked up at. The quicker you would get one of those things checked out, the less risk is involved in the long run. All right, so that completes the skin assessment. We're gonna go ahead and move on to respiratory. I've already completed most of the inspection of the respiratory system, but as I make my way to her back, I'm gonna assess that her AP to lateral chest ratio is 1 to 2. The next thing I'm going to do is feel your spine for any pain or tenderness. Are you experiencing any pain in your back right now?
No.
Okay, so can you go ahead and roll your shoulders for me? I'm just gonna make sure that palpation doesn't cause you any pain. Starting up here at the top and then feeling down each spinal process, wiggling back and forth left to right. Any pain with any of these?
No.
All the way down to the bottom of the spine. And then when the spine ends, I'm going to find where the spine meets the pelvis, and I'm going to move just to the left and the right. You'll feel one small push. Any sacroiliac tenderness?
No.
Okay. Can you help me by finding out where the base of your rib cage is? Can you kind of point to me where your ribs end?
I think here.
About there? Okay, very good. This will help me mark where your CVA angle is. You're going to feel some taps on your back. Let me know if it causes you tenderness or pain at any point. Starting up high and moving down low like a J, the letter J. Any pain?
No.
Okay, moving over to the other side, again marking the end of the ribs there. Starting up high, any pain with this?
No.
Okay, good. Again, assessing that I don't have any pain here at the point that of the CVA angle, so she's negative for kidney tenderness. Next, we're going to move to the most important part of your lung assessment here. That's going to be listening to your lungs. I'm going to have you take 10 breaths. It's going to be a lot, okay? You're going to breathe in and out through your mouth. If you get tired or you need a break, just let me know.
Okay.
All right, so finding the base of the ribs, moving up 2 spaces to the 10th rib space. All right, Miss K, can you go ahead and take a big deep breath in and out through your mouth? Thank you. Moving to the right again. 9, 8, 7, 6. About halfway up the scapula. Move your hair. All right, go ahead. Comparing to the other side. Go ahead. Up to the second. Other side. Doing okay?
Yeah.
All right, into the fossa. This is the top of your lungs. Deep breath. Thank you. Other side. Can you put your arms out like you're an airplane? Or a zombie? Either one works. All right, at the 6 intercostal space, at the mid-axillary line, deep breath. And same thing on the other side. Last one. Phenomenal. So your lungs are all clear to auscultation, which is a normal finding. Next, we're going to move on to tactile fremitus. I'll give you a break from breathing. You're going to feel my hands on your back. I'm going to ask you to say 99, nice and loud, okay, not dainty, when you feel my hands on your back, okay? So I'll give you the go-ahead. 10th rib space, go ahead.
99.
Louder.
99.
There you go. To the 6, moving in a little bit. Go ahead.
99.
Thank you. Again.
99.
Excellent. Again.
99.
And like an airplane. Yep. Again.
99.
Very good. So I can feel vibration. All those vibrations are equal and feel the same, which is a negative finding for fluid on the lungs or consolidation. Next is chest expansion. Again, finding that 10th rib space, placing my thumbs parallel to the spine, fingers pointed towards the armpit region. You're going to feel a nice squeeze in, almost like I'm going to pick you up, okay? But I'm not. I squeeze in and up. And now one big breath in and out through your mouth. Excellent. Very good. So if you're back here, you probably saw I could feel my hands rise and fall symmetrically, which is negative finding for a collapsed lung or pneumothorax. The last thing here, 2 more things we're going to do. We're going to finish up with percussion. You'll feel me tapping on your back. You can relax and breathe normally. 12th, 10th rib space. 1 finger on my patient's back, just the middle finger, lifting my other fingers up. 1 or 2 fingers to do the tapping. It's like a dart motion. At the 6. At the 2. What I'm listening for is that all these sounds sound the same. Sounds like there's good airflow. Arms out like an airplane again. And I don't hear any areas of dullness or any areas that are higher pitched, which would be hypo or hyper resonance. Thank you. So she had normal resonance throughout, which is a normal finding. And last, we're going to finish up by listening to your right middle lobe, which is only heard from the front. I'm going to have you take 4 more breaths if you have the energy. Okay, I'm going to start underneath your right clavicle, in and out through your mouth. Right below the right clavicle here. Go ahead, deep breath. Thank you. Again. Again. And 1 more. Excellent. Okay, so again, cleared auscultation. All right, that's where we're going to stop for today. Next week we pick up with cardiac.